We turn now to health. We have heard in the news recently quite a bit about the coronavirus, the outbreak in China. There has been concern about our students who are studying there. Government has issued at least 2 press releases on the matter. And this morning, Minister Steele and Dr. Sean Charles of the Ministry of Health will provide us with some updates on that and other health-related developments.
Thank you, Philomena. Dr. Sean Charles and myself are here primarily to talk about the various steps that we have been taking here in Grenada since the announcements coming out of WHO and Pan American Health, and also to take any questions or so that you might have concerning the coronavirus and health in general. But let me hand over to Dr. Charles, who will give you an update on the present situation that we have right now.
Good morning. Well, firstly, let me say that coronaviruses by themselves are fairly common. In fact, about 15 to 20% of the common cold that most of us would experience at some times in our lives is caused by one strain of the coronavirus or the other. However, what has been observed is that ever so often a new strain of this virus emerges and tends to cause even more severe disease. This has occurred back in 2002 when we had the SARS outbreak. Later on, around 2014, we also saw the Middle Eastern respiratory virus, the MERS, and that one itself, it's still circulating, but more so in the Middle East. This new virus that has recently emerged, like SARS, emerged from China. All right. There's a lot of concern about the virus because there's still a lot that is not known. All right. It is assumed that the disease might have originated from some species of animals and somehow made its way over into humans. And then from there, transmission from human to human has ensued. Now, since the end of December up till the 27th, which was yesterday, 2,801 confirmed cases have been identified and 8 deaths. 99% of these cases have been reported from China, and cases have also been recorded in 11 countries around the world. In our region of the Americas, so far there have been about 7 cases, 5 of those in the United States and 2 in Canada. What is encouraging so far is that there aren't reports of ongoing transmission in the countries where the diseases have been exported to. But we are still at early stages of this disease. And like I say, there are many things that still need to be understood about the infection.
Okay, thank you, Dr. Charles. I think before I go any further, maybe we can get some questions also from the press, either to Dr. Frederick or Dr. Charles.
Okay. Rena Pierre, GBN. A question, though as you said, the disease is in its early stage, is there any precautionary measures that is being taking place at our port of entries as it relates to the airport and cruise ship and stuff? We do have a lot of visitors coming in from the region. We're still in the peak of the tourism season, and we do have Chinese nationals here. So maybe some of them must have left for the New Year celebration coming back in.
Yeah, we have had a heightened level of surveillance at our ports, primarily Maurice Bishop International. That is monitoring all passengers coming off of all flights for any signs of the flu, primarily temperature, if they have a fever, primarily, but any other flu-like symptoms. That is done through video surveillance. Maurice Bishop International Airport, we have video surveillance that allows us to know the temperature of each person as they walk past the camera. And also with our nurses observing, and when necessary, they will approach passengers to take their temperature or whatever further examination they may see fit. So far, we have not had any passengers that have exhibited any signs that raises any level of concern. There is not the same level of surveillance at our cruise ship ports because the mere fact that the cruise ship industry as a whole treats their passengers getting on board a vessel and throughout their time on the vessel differently because of previous outbreaks of flus on cruise ships. So passengers are screened intensely and similarly before getting on a cruise ship, and then at the cruise ship they observe consistently the behaviors, etc., of passengers while on board. Also, that there hasn't been a declaration that there is an outbreak in any of the originating ports of cruise ships. So that is our level of heightened alert. That is what is prescribed at present. It is the same for most other communicable diseases that are airborne also, but we have increased that level to make sure that there is double coverage at Maurice Bishop International.
One of the requirements made by Pan American Health Organization was to ensure that nurses or anyone within the hospitals to be up to date as it relates to the virus and ways in which they're treated. We have any of this here?
Yes, there is, and in fact, there's consistently training with dealing with airborne, but we have discussed and confirmed over the next couple of days, in fact, starting today, there will be reinforcement of the training, just as a precaution, reinforcement of the training.
Christelina, John, GPN, just to piggyback a bit on what Rena would have asked, how about protection for the health workers themselves? How are we dealing with that just in case that we might have, some appearance, some semblance of this, coming into our country? And two, there are reports of a chartered flight that came in sometime this morning with a group of Chinese nationals into the country. Can you clarify for us, please, Minister?
Okay, on the health workers, yes, the required protective suits and masks are in distribution at the relevant points. So it won't be at all of our health centers at present, but it would be at Maurice Bishop International and then here at the Ministry for quick response or dissemination throughout. We will begin, as of today, dissemination of masks to our various health centers just as a precaution. There isn't any indication for otherwise, but just as a precaution to make the very health workers feel a little more comfortable that the masks are present, not that they would need to use it right now. And all flights, private or commercial, are monitored and screened. There was a private flight, because I've seen the rumors. I inquired and can assure you that that flight was met by healthcare workers, and everybody on board that flight was screened. And like all other passengers, where there is a point of origin close to China at this point in time, they're consistently monitored while they are here.
Can you clarify their purpose for coming in and where are they coming from exactly?
The flight originated, as far as I'm aware, in Beijing. It is a business. It is, I think, 8 passengers on it. And it's a private flight, so it didn't interact with other commercial passengers or at a commercial port where we would have seen the risk to be much higher. The Chinese officials are also ensuring nobody can leave China without screening as well, private or commercial. And then we also check on this end as well. So it's double coverage. The same with commercial flights. There is more of a risk when somebody travels on commercial flights, but there's screening at all ports when you leave as well as when you enter.
Sherry and Noel, GIS. Minister, although a release was issued yesterday, I think most Grenadians are interested in the well-being of the students. We know that there are students in the province where the virus is. What update can you give in terms of assurance that the students are being taken care of and they are safe?
All of our students are being communicated to by the embassy. I know I've seen certain posts on social media that that's not the case, but I'm also seeing the reports from the ambassador that that is the case, that they are being communicated to. And as I said last night on an interview, if there's any student that hasn't been or feels that they need to be contacted a little further, there are numbers and ways. The social media communication in China is a bit different. The situation in China is chaotic in those cities, Wuhan in particular. It is chaotic. The city is on lockdown. The safest and best thing for our students to do is the same thing that is the safest and best thing for the Chinese citizens to do. Stay indoors, stay put. Travel is where the risk. Travel and large associations or getting together in large groups, whether it is at bus stations, train stations, airports, or parties or whatever, all of that has been cancelled. If our students were to try to transit out now, they would be put at greater risk. At this point in time, it is the same for all, whether you are Grenadian, whether you are Chinese, whether you are American, whether you are British, it is to stay put. The city is quarantined. Anybody trying to move, say from Wuhan to Beijing, would put themselves at risk and those in Beijing at risk as well. So that is the reality of the situation right now. So we are in constant communication, and as the release has shown, the Chinese government remains willing and able to assist wherever possible. But it is a unique situation on the ground. So constant communication is, I think, what is essential in this instance.
I just want to add here that the reason I was late was just coming from a meeting that the Prime Minister had with the Chinese ambassador, actually. And this, of course, the coronavirus outbreak was one of the subjects of that discussion. Our students are okay as of now. And basically, the ambassador would have reinforced the points that have already been made. The cities are on lockdown. The students that are there, they simply have to stay just as the advice is being given to others. So it is not recommended that they leave at all at this point. And the Chinese government has said that it is sending in additional medical teams to Wuhan in particular to help control the outbreak.
And just a final part to the question, and in terms of the communication between parents and guardians?
That I'm not aware of directly. I know that the Ministry of Foreign Affairs and the Ministry of Education have been reaching out to parents and guardians. I would just say that if there are any parents or guardians or family members that feel that they are in a void of information, please contact us. Please feel free to contact us, Ministry of Education, Ministry of Foreign Affairs, or GIS, so that we can provide relevant information, or if they have additional information that they believe we may not have, please feel free to share that as well with us.
Good morning, Callistra Faria. Dr. Charles, Jean Charles. With the virus, with all of the stringent screening at the ports of entry, can you tell me what level of risk still exists for transfer of the virus into a new territory based on the fact that these things have an incubation period? So you've gone through a battery of checks in China, you get on a plane, or a battery of checks in the UK at Heathrow, wherever, and you get on a plane. What is the risk to Grenada at that point, given, is there no risk at all, a lot of risk? Give me an assessment of the situation, please.
All right. I remember one of the things I said was that a lot is not known about the disease. WHO has quantified the risk for China and for the region and for the rest of the world. The risk in China is high. The risk for the immediate region around China, the risk in China is very high. The risk for the immediate region, the Asian region, is high, and for the rest of the world, there's a moderate risk. But there's a lot that is not known. All right, we still have to define how transmissible is a virus. We have established that there is transmission ongoing, human to human, but we know that it's generally among close contacts. However, as the condition unfolds, one of the things that needs to be determined is how transmissible. All right, and that will determine how easily spread. So, for example, if it is discovered that a person incubating the virus, even before showing symptoms, is able to, if it is formally established that that person, even before showing any symptoms, can transmit the disease, similar to, let's say, measles, all right, then that it's something quite different, because someone can go through the screening not having any symptoms and be able to still transmit the disease. So a lot is not known, and it will be very difficult to quantify the exact risk. What I can tell you is, in the Caribbean region, no cases have been identified. All right. So the risk for us at present would be not very high.
So because of how little we do know about how the virus behaves, it could be quite possible that allowing persons to land, for instance, Beijing, they have reported a death in Beijing. So it's actually getting out of Wuhan based on reports from international news agencies and so. So that because we don't understand how the virus, it is possible, it is a possibility that it can, we can be affected, that a plane load of people, for instance, landing at Morris Bishop at 2 a.m. in the morning and appearing healthy, passing the test, can still put us at risk. Is there any risk at all?
My answer to that would be yes, in the same way a plane load from the UK, a plane load from Canada, and a plane load from the US. That the virus exists in those countries as well. So yes, as Dr. Charles says, there's a lot we don't know, but we do know how to determine, in most cases, the level of risk. But this is developing as we speak, but one can determine the level of risk and the protocols to be taken. And those protocols are being taken, which is why right now, Grenada, as well as all of the Caribbean and the rest of the world, has not shut down and close all borders. If that is a directive, then that most definitely, we would not hesitate to take that action if that is the recommended action. Right now, that is not the recommended action to be taken by the world, not just by Grenada, by the world. This is not something unique to Grenada that we must write a playbook on our own. This is an international agenda or issue. It is an international threat. Grenada is a member of Pan American Health Organization and the World Health Organization, and our participation, active participation. In fact, at 12:30 we will have another. We've had daily meetings with Pan American Health Organization, and we will have another one today, as we have had all of last week with all of our Caribbean associates as well. And we continue to monitor the situation. We continue to exchange information. We knew of that flight coming probably about 2 or 3 days ago, and we checked and confirmed and discussed with Pan American Health Organization as to any risk or the level of risk involved there. And we got a concerted answer and response from them. There is higher or just as much risk of someone transiting through one of the major international ports as there is from somebody being checked and confirmed. It's isolation. The less circulation an individual has, the better for them. Whether they're in Wuhan, whether they're in Grenada, or whether they're in Washington State or Toronto, is the less circulation. The more that somebody circulates, so if individuals have been isolated and traveled privately, if individuals have been in the UK or New York or so, they are not at risk. So the situation is similar. It was determined and with coordination with Pan American Health Organization in terms of any risk levels.
Any particular reason why the flight came in at that particular hour? I understand it came in at 2 a.m. Is that information correct? And any particular reason?
It's a long flight time. It left probably at 2 p.m. in Beijing time, and it is quite a long time to get from Grenada to Beijing or Beijing to Grenada. No, it wasn't in any effort to hide their presence or so. There are private aircraft that land at that time otherwise, or so, based on private aircraft schedule. That is not a time for commercial airlines because we conveniently organize the arrival time for commercial airlines. But that was not out of the ordinary and wasn't in any effort to mask because we were notified in advance and made all of our preparations in advance.
My final question. The stock of pneumonia medicine for treating pneumonia and other bronchial situations. How are we at the hospital? Because I know we had an issue which was confirmed that we were out of pneumonia medicine at one point sometime last year in flu season for bronchial infections and those respiratory problems and so on.
We don't have any confirmation of that, and I would like you to share with us this confirmation you have.
Minister, I'd be happy to chat with you after the news conference.
No, you made it public. You made a public statement, and as a responsible journalist, you need to be able to show the confirmation that you got.
As a responsible journalist, I will put the information in the story I write. That's
Dr.
where
Sean
I
will
put my
answer you
information.
on the level of medication.
Right. So, pneumonia is an infection in the lung, and there can be different causes. So there isn't a single treatment for pneumonia. Pneumonia that are caused by bacteria are treated by antibiotics. Those that are caused by fungus are treated by antifungi, and those that are caused by viruses are treated by antiviral medication. All right. So at any one time and from patient to patient, the treatment will vary.
So not to hold the news conference, but could you speak to the antiviral ones, because I understand that antibacterial treatments may not necessarily work with complications and developments from the coronavirus. So do we have what we need in terms of those particular medications if people become infected?
There is no identified medication for this strain of the coronavirus.
For treating pneumonia
the
or
strain.
bronchial infections.
Well, like I said, it would all depend on the cause. So if it's bacterial, I mean, we have antibiotics. I'm not aware that we've run out of antibiotics at all. All right, so it depends on the treatment. As Minister mentioned, this present coronavirus and for the majority of viral infections, such as the flu and common cold and so on, there is no specific treatment. All right, there is no specific treatment. This present coronavirus, there is no vaccine, there is no treatment. The treatment is supportive. All right, so someone, if they're severely ill, they will be admitted. If their illness progresses to the point where they require respiratory support, then they will be treated in ICU, ventilated, and so on. But there is no specific drug to treat it.
I wasn't asking about treating the corona. I'm well aware of that situation.
Kalishra, I think you've had sufficient questions for now. Let's see if there are others in the room who have any additional questions.
I have additional questions, but I don't know if Minister would be speaking on other areas of health, or should I just go to it?
Go right ahead.
Okay, so my other question is in relation to the latest development that we have had with this young man named Akim Andrew, who would have infiltrated the system and was able to, you may say, perform duties of a doctor. How concerned are you as health minister, and how easy it is for someone to penetrate the system? And are you, perhaps, say, concerned of other cases that might be existing that we're not aware of?
The licensing authority and enforcement agency for medical and dental practitioners is the Grenada Medical and Dental Committee, the council, sorry. They're the ones responsible. It's independent of the Ministry of Health. The chief medical officer is a member of that council. They're the ones that will check individuals for the validity of their license, etc. Now, somebody coming up and pretending just on his own that they are a medical practitioner, now it would be for police, members of the public or Ministry of Health to be able to see that an office has opened or somebody is moonlighting. We are aware of the facts, and based on the facts, we have a level of concern and have made efforts to contact all of the individuals who may have been dealt with by this individual, just to check on them. And that is the level. The Ministry of Health is not the enforcer. We are there for public health, and even our doctors must clear with the Grenada Medical and Dental Council, must be approved by the Grenada Medical and Dental Council. So it is them that are responsible for that. That's not passing the buck or so. Somebody wanting to pretend to be a policeman, to pretend to be a doctor, pretend to be a journalist, it's still among the peers for self-enforcement or members of the public to question the qualifications of the individual.
Are they the ones?
If I might add, the list of registered doctors in Grenada was recently gazetted. So you can just check from there.
So how regular are reviews conducted, if you can answer to this? And why is it only the Gazette? Because not everybody that really would say have access to a newspaper, so to know when that list is really established.
Well, speaking as a doctor, when your license is renewed depends on when, on the date that you fulfill all the requirements for licensure. All right. So each doctor has a different date, and that fulfillment is with the Medical and Dental Council. I believe the license is renewed every 2 years or maybe every 3 years. All right, and you must present evidence of continuing education and pay the requisite fees and so on.
Okay.
All right, ladies and gentlemen of the media, thank you very much for your presence here this morning. We had some very tough issues this morning. The coronavirus, a very concerning issue for us, as it is for the rest of the world, but with the approach that is being taken by the Ministry of Health in collaboration with PAHO and the World Health Organization, I think we will be in good stead, and we need to just continue observing the things that we need to do. That brings us to the end of this morning's edition of the Post-Cabinet Press Briefing. I'll see you again next week.
Just one quick announcement or statement. But two. One is that yesterday I was just informed by Ministry of Finance, and I want to thank them and congratulate them for that. All established public servants were paid with the agreed upon increases. That was done yesterday. So I want to commend them for that and working, I'm sure, overnight over the last couple of days or so to make sure that happened. The other thing is for members of the media and members of the public as a whole, with respect to the coronavirus, be aware of what are the facts on this, and be aware of attempts to sensationalize and also false information that is passing around. Not everything on Facebook is true. Do your homework as members of the public or members of the media and double check. Double check everything. Check your source out and see how good it is, and rely on the WHO, Pan American Health Organization, and your Ministry of Health to be providing the relevant information.
Thank you very much, Minister. That brings us to the end. I'm Press Secretary Philomena Robertson. Thank you for joining us today.